Prime Minister Boris Johnson is tonight in intensive care at St Thomas's Hospital in London, suffering from the effects of coronavirus. Mr Johnson was admitted last night, but his office says his condition worsened during the course of this afternoon, and on the advice of his medical team, he was moved to the intensive care unit. Earlier today, the Prime Minister, who's 55, was said to be in good spirits, receiving treatment for what were called persistent symptoms, including a temperature and a cough. He tested positive for the disease 10 days ago. The Foreign Secretary, Dominic Raab, has been asked to deputise for the Prime Minister where necessary. Let's start tonight by going live to our political editor Laura Kuenssberg at Westminster.
Huw, we've been in a rather strange vacuum for much of the day, with very limited amounts of information about how Boris Johnson was after he was taken to hospital last night. We were told this morning he was in good spirits, even that he was still receiving red boxes full of government business and still in touch with his team. But shortly after 8 o'clock, an official statement from Downing Street with a very different tone. It's said to be as a precaution. The Prime Minister is said to be conscious. But Boris Johnson tonight, just across the Thames, is in intensive care. Less than a mile from Downing Street, Boris Johnson is in intensive care tonight, in a personal fight against the virus that the government and the country is trying to beat. Who'd have known on Thursday night that the health workers he applauded would be caring for him like this? Brief glimpses of Boris Johnson on social media made it clear he was struggling to shake the virus off.
My 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature, and so...
Now, after being admitted to hospital last night for tests, he is conscious, but as a precaution, Downing Street says has been moved to intensive care. And the Foreign Secretary has been asked to step up for now.
During the course of this afternoon, the Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit.
With the Prime Minister now in intensive care, this is obviously an extremely serious situation. I mean, how worried should people be about his health and about who's in charge of the government?
Well, the government's business will continue, and the Prime Minister is in safe hands with a brilliant team at St Thomas's Hospital, and the focus of the government will continue to be on making sure, at the Prime Minister's direction, all the plans for making sure that we can defeat coronavirus and pull the country through this challenge will be taken forward.
Are you confident, though, that the government is under control tonight?
There's an incredibly strong team spirit behind the Prime Minister and making sure that we get all of the plans that the Prime Minister has instructed us to deliver, to get them implemented as soon as possible. And that's the way we will bring the whole country through the coronavirus challenge that we face right now.
Just after 8 o'clock, the official statement came from Downing Street, saying over the course of this afternoon, the condition of the Prime Minister has worsened, and on the advice of his medical team, he's been moved to the intensive care unit at the hospital. The Prime Minister has asked the Foreign Secretary, Dominic Raab, who is the first Secretary of State, to deputise for him where necessary. The Prime Minister is receiving excellent care and thanks all NHS staff for their hard work and dedication. Good wishes from friends and rivals of Boris Johnson's flooded online within minutes. From the First Minister of Scotland and the brand new Labour leader, and from someone who knows him and the unique job very well. The Prime Minister is now suffering seriously from a disease that does not pick and choose. Downing Street itself, a place where the virus spread. Power, no protection from harm. Laura Kuenssberg, BBC News.
We'll talk to Laura in a second, but first let's go to Vicki, our chief political correspondent at St Thomas's Hospital, where the Prime Minister's been treated. What can you add, Vicki, at this stage to what the hospital authorities are saying there about the Prime Minister's condition?
Well, after 9 days in self-isolation, he came under the care of doctors here last night and was admitted to hospital. Now, we know that he has been suffering from this persistent cough and temperature, something he couldn't shake off, which is why he was brought into hospital in the first place. Now, it's worth saying St Thomas's Hospital is one of the top hospitals in the country. It's just across the bridge from the Houses of Parliament. Now, we were told by Downing Street earlier the Prime Minister was working from his hospital bed here. We understand that he was given given oxygen before that decision was made to move him to intensive care. Now, we're told that that has been done as a precaution. It's been done in case he needed ventilation to aid his recovery. Now, like thousands of other families who've been affected by the coronavirus, this is an extremely worrying time for him and for his family, especially, of course, his fiancée, who is pregnant and has been suffering with symptoms of the coronavirus herself.
Vicki, many thanks. Vicki there at St Thomas's. Let's go back across the river to Westminster, and Laura's there for us. Laura, you asked Mr Raab directly about the functioning of government. What did you make of the answer?
Well, I think Dominic Raab, perhaps not so very surprisingly, looked pretty shocked by how things have been moving tonight. The Foreign Secretary now is technically in charge, as he is the Prime Minister's official understudy, and he has been requested by Downing Street to deputise for him as and when. And government insiders are pretty confident. They say that the way that the cabinet committees have been designed to try to deal with coronavirus into 4 different groups, looking at all the important elements, that will continue to tick over. One cabinet minister had said to me that the decision-making was pretty crisp, pretty efficient, and this had been happening whoever was in charge. But a Prime Minister, of course, is much more than a political mascot. They are, of course, also the most senior decision maker in any government. And at a time when there are so many dilemmas about the health and the wealth of the country, this is obviously a very serious moment for the government and the Whitehall machine. Even for the Prime Minister, who was popping up every now and again, trying to sort of say that he was fine and he was getting better throughout this, it has created a sense already of not that much stability with him being ill, and even just when he was in the Downing Street flat. But now, with him in intensive care tonight, even though we should emphasise it's said to be as a precaution, this is obviously a grave moment, one that's very unsettling for the government. And at a time like this, which is a genuine national emergency, irrespective of your politics, of course, this is clearly a terrible time for the government to be without its figurehead.
Laura, we'll talk again later. Thank you very much. Laura Kuenssberg there for us at Westminster. So as we heard, the Prime Minister's condition worsened during the course of the afternoon, and that was when the medical team decided it was best to move him into the St Thomas's intensive care unit. So let's talk to our health editor, Huw. Huw, lots of people will assume automatically that going into intensive care will involve a ventilator and all the other apparatus that we've seen in reports. Would that assumption be correct?
Well, normally, yes, Hugh, and we should say it's the sickest patients who go into intensive care, so clearly this is a cause for concern. But the Downing Street statement made clear it was a precaution. He'd been moved to intensive care at St Thomas's should he require ventilation to aid his recovery. That suggests he's not on a mechanical ventilator to help his breathing, which would require sedation, but he will be requiring oxygen through a mask or nasally. Now, he'll be continuously monitored, oxygen levels in his blood, his kidney function and heart rate. There'll be a nursing ratio probably of 1:1 in intensive care. Those ratios have been pushed back a bit because of pressure through COVID-19 patient numbers. There'll be consultants on call through the night to monitor his condition, to see how things are getting on. And I should say the team at St Thomas's are experienced in COVID-19. They were one of the first hospitals to take patients with coronavirus in early February as a specialist infectious diseases centre.
We'll have another update from you later, Huw. Thanks very much for now.